What techniques minimize rippling with Saline implants? Imagine your breast augmentation, results looking smooth and natural, without those unwanted ripples or waves. That's what many patients hope for when choosing Saline implants. Rippling happens because the Saline solution inside the implant can shift and cause visible folds on the surface. But there are several proven techniques surgeons use to reduce this issue and improve your outcome. First, filling the Saline implants correctly is key. These implants are inserted empty and filled during surgery. Filling them to the recommended volume ensures they fit snugly in your breast pocket. Slightly overfilling the implant by about 30 to 50 cubic centimeters can help reduce rippling, but going too far beyond that can cause other issues. Proper fill volume prevents the implant from folding or developing visible waves. Choosing the right implant size and shape also makes a big difference. Implants that are too large for your natural tissue or the pocket can increase rippling. Wider implants tend to have more coverage over the edges, which helps hide any ripples, especially in patients with thinner tissue. Your surgeon will help select an implant that fits your body comfortably and minimizes rippling risk. Placing the implant beneath the pectoral muscle, known as submuscular placement, is another effective technique. The muscle provides an extra layer of soft tissue coverage over the implant. This extra padding helps hide the edges and smooth out any ripples, particularly in patients with less natural tissue coverage. Creating a properly sized breast pocket is essential. The pocket should match the implant size closely. If it's too loose, the implant can move around and cause ripples. If it's too tight, it can distort the shape and lead to rippling. Precise pocket creation ensures the implant stays in the right position and maintains a smooth contour. Adding extra soft tissue coverage can also help. Techniques like fat grafting, where fat is transferred over the implant, or using acellular dermal matrices, which are special tissue scaffolds, can increase tissue thickness. This additional padding helps conceal any ripples and creates a more natural look. Maintaining a stable body weight is another important factor. Fluctuations in weight can stretch or thin your breast tissue, making ripples more noticeable. Keeping your weight steady helps preserve the soft tissue coverage over the implant, reducing the chance of rippling. While Saline implants are popular, some patients consider silicone implants, especially cohesive gel types. These tend to have a thicker fill that naturally reduces rippling because they are more stable and mimic natural tissue better. However, if you prefer Saline, the techniques mentioned above are your best options for minimizing rippling. In summary, avoiding rippling with Saline implants involves choosing the right size and shape, filling the implant properly, placing it under the muscle, creating an accurate pocket, and adding soft tissue coverage when possible. Keeping your weight stable also helps. Always consult with a qualified plastic surgeon who can tailor these techniques to your unique anatomy. Remember, each person's body is different, and personalized advice is essential for the best results.